And from there, you use a simple example of like public speaking. So if there's anyone in the crowd who's uncomfortable with public speaking, with a lot of educators are, which is funny because they public speak to their class all day. But if you ask them to get up in front of their coworkers, like, no thanks. You have these physiological reactions to a fear of public speaking. Your heart rate goes, your cheeks flush, your hands shake. Katie says sort of like gobbledygook words, and then
Just
people
mark
write
them.
them down because she's a doctor, and they're like, that must be real. I'm like, nope, she's just nervous. That's not a real word.
That's great.
But you can't just tell your brain, like, don't do that. Don't be nervous. Don't shake. Don't say that weird thing. You can't think yourself out of that response. So we do things that mimic the very first things that made our brain and body feel calm when we were in utero, when we were infants, which is we introduce rhythm and pattern. And so if you calm a baby, you don't tell an infant, hey, calm down. Now's not the time. They don't listen, right? You do things like pat their bottom, you rock them, right?